Welcome to our exploration of joint flexibility, a crucial aspect of human biomechanics. In this video, we'll dive into what joint flexibility means, why it matters, and how it affects our daily movement and overall health. Whether you're an athlete, a fitness enthusiast, or simply interested in how your body works, understanding joint flexibility can help you move more efficiently and avoid injuries. We'll also discuss different approaches to increasing or maintaining flexibility, weighing their advantages and disadvantages. Let's start by defining what joint flexibility is and why it's so important for everyone. Joint flexibility refers to the relative ranges of motion available at each joint in the body. It's about how far a joint can move in different directions, measured in specific planes of motion. For example, your shoulder can move up, down, forward, and backward, each with its own range. The term range of motion, or ROM, describes the angle through which a joint moves from its neutral anatomical position to its furthest limit in a particular direction. Understanding ROM helps us assess flexibility and identify any limitations or pain points that might affect movement. Better understand joint flexibility. It's helpful to visualize the anatomical planes and axes along which movement occurs. These planes, sagittal, frontal, and transverse, define the directions in which joints can move. For instance, bending your elbow happens in the sagittal plane, while lifting your arm sideways occurs in the frontal plane. By considering these planes, we can more accurately describe and measure joint flexibility, ensuring a comprehensive assessment of movement capability. Measuring joint flexibility is a precise process. Tools like the goniometer are commonly used to determine the range of motion at a joint. The goniometer measures the angle in degrees from the anatomical position, which is considered 0 degrees for all joints. By moving the joint through its full range, we can record the maximum angle achieved in each direction. This measurement helps track progress, identify limitations, and guide interventions to improve or maintain flexibility. Practice range of motion is measured directionally, and each joint is assessed for its ability to move through specific angles. For example, a healthy knee might flex to about 135 degrees, while a shoulder can have a much wider range. These measurements are essential for athletes, physical therapists, and anyone recovering from injury. By understanding the normal ranges, we can spot abnormalities and tailor exercises or treatments to individual needs. Several factors influence joint flexibility. The shapes of the bones that form the joint, as well as the presence of muscle or fatty tissue between them, play a significant role. Additionally, the laxity or looseness of the collagenous tissues and muscles crossing the joint affects how far it can move. Even temperature can make a difference. Warmer muscles tend to be more flexible. Understanding these factors helps us appreciate why flexibility varies from person to person and even from joint to joint. Flexibility is generally beneficial. Both extremely high and extremely low joint flexibility can increase the risk of injury. Joints that are too loose may be unstable, leading to dislocations or strains, while joints that are too stiff can be prone to tears or overuse injuries. Weak muscles, tendons, or ligaments further raise the risk, as they provide less support to the joint. It's important to find a balance that allows for safe, effective movement without compromising joint integrity. Physical activity plays a crucial role in maintaining joint flexibility. Regular movement helps keep collagenous tissues long and pliable, supporting healthy joint function. On the other hand, decreased activity can lead to the shortening of these tissues, reducing flexibility and increasing the risk of stiffness or injury. Incorporating stretching and varied movement into your routine is key to preserving joint health over time. Summary: maintaining or increasing joint flexibility involves understanding the unique characteristics of each joint, measuring range of motion accurately, and considering individual factors like bone structure, tissue quality, and activity level. While various methods exist to improve flexibility, it's important to weigh their pros and cons and avoid extremes. By taking a balanced approach, you can support joint health, enhance movement, and reduce the risk of injury throughout your life.